1 minute. We'll be getting started in 1 minute. Oh, you're not in? Oh, I'm sorry. You in? All right, you're good now. Yeah, sorry about that. Thirty seconds. 30 seconds. Getting started in 10. Oh, wait a minute. Wait. Wait, now I'm going to let everybody in. Sorry. Yeah, no, I never let everybody in. All right. Now we're good. Got to do the 1 minute countdown one more time. Sorry about that.
If I hit that.
Okay. Hello, everyone. Thank you for joining for the governor's press conference. We'll be getting started here shortly. Once again, reminder, we'll be calling on each news outlet individually throughout this press conference, as we've done many times in the past. Please keep yourself on mute unless you are called on for your question. TV stations will be getting started in 1 minute. TV stations will be getting started in 1 minute. Thirty seconds. 30 seconds. In 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good afternoon, everybody. It's been a couple of months since our last COVID briefing, but a lot is going on, both around the world and here in the Northeast in particular, where you see an uptick in infections, what you see in terms of boosters, and what you see in terms of vaccinations now for the 5 to 11-year-olds. I thought it was worth an update with Manisha, who you now know is our Commissioner of Public Health, and Josh and Paul are back for old time's sake. Let me just tell you where we are in the numbers right now, first of all. I think what's interesting is our daily positivity rate is at 3.5%. That is, as you know, gone up quite a bit over the last month or so. 7-day average, 3.3. What does that mean? It's probably the highest since early September. You can take a little bit of comfort, but not a lot of comfort in the fact that it's by far the lowest in our particular region. If we're 21 infections per 100,000, New York and Massachusetts are about 50% more than that. Rhode Island is double that. Vermont is triple that. And that is just a reminder that we're not an island, and that's why we got to continue to be very cautious. But there is some good news as well. The next chart, I think, gives you a better idea of where you are nationwide. You can see that Connecticut up there in the Northeast still is white. That means a relatively low infection rate. But as I suggested before, we're still surrounded by a part of the country, the Northeast, New England, that's getting redder and redder. What's interesting about this chart is that the it's a sort of a mirror image of where you were, say, 90 days ago, where the South and Florida and Georgia and Texas and Alabama were on fire, and we were, very, very low infection. Now, given seasonality and the flu season and the such, that has shifted around a little bit. It's worth noting, I always have looked overseas to get a little indication of what's going on. You've probably heard that Germany has got a big infection rate spiking up. Austria, very high. They are beginning a lockdown. You've seen there have been some demonstrations and protests against that as well. Israel, sort of interesting. They were flaring up, and they didn't mandate, but they allowed vaccinations for everybody, booster shots for everybody over the age of 12. They got that done a few months before us, and that really did bend the curve in a dramatic way. The next chart, I think, is hopeful in this sense. The blue line shows you COVID hospitalizations last year, and the yellow line is COVID hospitalizations this year. It was interesting, if you saw the news in the last couple of days, that we have more COVID infections in 2021 than we had in 2020. You thought we were rounding the bend in 2021 with masks and social distancing, testing and vaccinations, but it also hit hard, especially in the South, where the vaccination rate was a lot lower. Sort of staggering to me that we have now lost more people to COVID than we did in all wars America has fought in. But the positive is, on the blue, you see how we were hit hard last March, April, May. You see that big spike there. But you see, we've gotten better in each rolling iteration, each continuing flare-up. So by the time you get to 2021, the yellow line, on the far left there is the early part of the year, a little less than where you were a few months earlier. We had a bit of a flare-up in the summer, and you see the hospitalizations continue down. That's just one more reminder that while the vaccinations are very good at preventing infections, they're extraordinarily effective at keeping you out of the hospital and keeping you out of the morgue. The next shot sort of bears this out in its own way. This is the unvaccinated are 5 times more likely to get COVID-19. The unvaccinated 5 times more likely. And you can see the relative chart. The light blue is the vaccinated. The red is the unvaccinated. You see 4 to 5 times more likely. But Manisha reminds me what's much more staggering is the unvaccinated are 10 times more likely to go to the hospital and 15 times more likely to suffer a fatality. 15 times more likely. Just one more reminder what a difference the vaccinations are making. So this next chart is just a statement of where we are today. When it comes to fully vaccinated, you see we're about 84% of our folks 18 and above are fully vaccinated. It's more like 94% of everybody 18 and above have had at least one shot. Everybody over the age of 65 is fully vaccinated. Some of the younger folks, only one shot. But that made us number 1 in the country. The booster shots is a slightly different story. We're at about 18% of all the eligible 18 and above have gotten their booster shot. That's not number 1 in the country. It's 9 in the country. So still doing very well, but we got to do better. If you're wondering, hey, who is doing better in terms of boosters, it's those states that were hit hardest by COVID, before we were. That's, more recently, Vermont and Maine, but Colorado, Wisconsin, those states are very red right now, and their people are going and getting their booster. So my advice to you is don't wait. Here's our chance to get it now before bad stuff can happen. We tried a lot of incentives. Some states were giving you free lottery tickets if you got vaccinated. Other states, like ours, give you free drinks if you got vaccinated. It seems to be when people see the possibility of a spike up in infections, people come back. So I'm giving you a little head start in terms of where we may be over the next few weeks. Reason number 39 to get that booster now. Or if you're one of the last holdouts, that last 5% that hasn't even gotten your first shot, here's your opportunity to do that. We're making a special effort in our nursing homes. Josh tells me we're bringing booster clinics to all of our nursing homes. You know how hard they were hit a year and a half ago. We got everybody there vaccinated, but that's in many cases 6-9 months ago. So now's the time for both the nurses as well as the residents at the nursing homes to get your booster shot. We're bringing it right there for you, and it's the right thing to do to keep you safe and others. The next, on the other side of the age spectrum, are the vaccinations for the 5 to 11-year-olds. Here we have about 20% of the eligible population vaccinated. That's about 56,000 over the last 3 weeks. These are 5 to 11-year-olds with parental permission have gotten their first vaccination shot. The average around the country is about 10%. We're 20%, so we could be a lot higher, but we're doing pretty well. And this is really important. Obviously, we got clinics in our schools. We got the federally qualified health centers. Go to CVS, go to Walgreens. We're trying to make it as easy as possible for this age group to get vaccinated, just like the boosters going forward. It was a big weekend this last weekend with people doing this. And if we get through this Thanksgiving season, we get through the Christmas season, if the overwhelming majority of our 5 to 11 and 5 to 18 are vaccinated, the teachers have gotten their booster, there may be some therapies to help keep grandpa safer. We'll find that we can maybe take a second look at masks. But in the meantime, let's err on the side of caution a little bit longer. The final chart is we got the biggest holiday season of the year coming up. Thanksgiving right through the Christmas holidays. An awful lot of travel going on. I think you've known in years past with Delta and what happened last year, there's a big toss salad, a lot of people moving around in trains, planes, so this is why you err a little bit on the side of caution. What we're doing is making sure that there are vaccine clinics. Just walk up, take advantage of the vaccine or the testing at Bradley Airport, New Haven, Stanford train stations. Make it very easy for you to do that. As you know, by federal law, you've got to wear the mask in the airports. You've got to wear the mask in the rail as well. But that being said, still, if you haven't gotten that booster yet, we're making it as easy as possible for you to do that right now. So with that gives you an update, a little bit of where we are as we get through the first month or so of the flu season. Still in a relatively good shape compared to our peers, but the numbers have ticked up, as we knew they would compared to, where we were 3 months ago. We're much better prepared than we were a year ago, much better prepared than we've been. You've got the vaccines, you've got the boosters, we've got the masks. We're going to get through this, no question about it. Let's make sure that the next wave is the most mild of all. With that, any questions, Max?
News 12 Connecticut.
Good afternoon. You actually mentioned what was going on around the world, and in Israel, they actually do, to go to certain venues, require a booster. Do you see United States communities following in that path, and when do you think that might happen?
Well, I can start with that, and then Josh and Manisha may have some ideas. As you know, in each of these stages, we've always tried to work with encouragement and voluntary participation. We did really well on, masking compared to everybody else. We did very well on vaccinations. We had to have some mandates at the very end for some key employees like nurses and nursing homes and the such. So at this point, when it comes to boosters, I don't have any plans for any mandates. I'd like to think that over the next 30, 60 days, you're going to see real progress with Connecticut folks doing the right thing, stepping up, getting their booster, or making sure their child gets their vaccination. People nodded. I think that's okay.
NBC Connecticut.
Hey, Governor, it's Leslie Mays from NBC Connecticut. I guess my question for you would be, in light of the jurisdictions that we've seen roll back the mask mandates because of how we've been doing in the way of COVID numbers getting better, but now there being a turn, Are you concerned that if more people are not vaccinated or don't get boosters as we head into the holidays, that we might see another reversal of that reversal?
I'll start. Josh, I'll hand it to you. But first of all, I think the masking in schools continues to be important a little bit longer. I looked at Britain, for example, that said, their adults were pretty well vaccinated, but they said your kids don't have to your kids don't have to wear a mask. We're going to let it rip. And you saw a real spike up there. Kids not necessarily suffering real complications, but bringing the infections home to others. So we don't want that to happen here. Josh, anything else? Manisha?
So I think people in Connecticut have really seen how masks have helped people be able to get out and go about their business and do what they need to do. And in a lot of communities, even if there isn't a mask mandate, people are choosing to wear a mask when they go indoors with others. So I think at this point, we are getting to the point where people know the measures that they can do to help protect themselves and help protect people around them. And so ultimately, it's going to be up to the citizens in Connecticut to decide how they're going to move forward with protecting themselves and others around them. So I think that this is something that, regardless of what the laws in your particular jurisdiction may be, that people will be able to help make decisions to keep their community safe.
News 8.
The better it is for everybody. We sort of simplified the language. Remember, CDC had a complicated set of metrics for who should get the booster. The answer is really everybody should get the booster. If it's been more than 6 months since you had your last vaccination, J&J, everybody should get the booster now. Manisha, do you want to add to that?
Bob, I just want to reiterate, if people go to ct.gov/COVID vaccine, you can find multiple clinics that are around you, whether it be pharmacies or other clinics, DPH vans, where you can either walk up and get a vaccine or make an appointment to get one. So make sure to utilize that resource, which is available to help you find a vaccine that's close to you quickly.
Channel 3 Eyewitness News.
Governor, in the last week or so, we've seen the cases per 100,000 really spike here in Connecticut, and that's before we get into the Thanksgiving holiday. So how concerned are you about people traveling to some of our neighboring states and coming back and driving that spike even higher?
It's not like it was in the bad old days where other states would be, 8, 10 times ours, and you didn't necessarily want people flying back from Florida because of the real fear of contagion. While, Rhode Island and Vermont are a lot higher than us. We're all more or less, I think, in the same metric. Obviously, if you're traveling, I hope to God you've been vaccinated. I hope your family's been vaccinated. I hope you've gotten that booster. I think you can afford to travel, but you can afford to travel safely. That's the best way to do it.
And then if I could also ask on child vaccines, I know you said you feel like we're off to a good start. Does that trend weigh on your thinking about the possibility of mandating it for schools? Does that make you less likely? Or if that sort of fizzles out, would you consider mandating the vaccine for students?
No, I don't think so. It's still emergency use, which I think gives, shouldn't give you pause, but it gives some folks a pause. I really think that a little like it was with nurses and some other categories, a lot of folks say, look, I'm not necessarily sure I want my 7-year-old to be in the very first week or two of kids getting vaccinated. But now we're in weeks 3 and 4 and 5, and I see my neighbors are feeling safer, and they can travel, and they know their kid is safe. I think you're going to see the number of young people accelerating. No need for a mandate.
Fox 61.
Hi, Governor. This is Gabby Molina with Fox 61 News. Is there a certain percentage of kids vaccinated that you want to see before considering getting rid of the mask mandate? I know you said more than 90% of teachers are vaccinated. Is there like a specific number that you're looking for when it comes to kids now that they're eligible as well?
Certainly, I want to see the community spread stay low or be lower. Especially coming after Thanksgiving and after the Christmas holidays and all that, what that means. You'd like to see the vast majority of the kids vaccinated. I think that makes a big difference. So those will be two key determinants going forward.
And Dr. Jitani, could you just put into perspective a little bit this increase that we are seeing? I mean, Connecticut, although we are seeing it double or the increase go up by a lot, it's still a pretty low, like the governor mentioned, especially compared to our surrounding states.
So in the chart that the governor showed, which showed our huge spike at the very first wave of COVID back in 2020, and each wave that has come since then has been smaller. And this is in part to the mitigation measures that have been in place, the distancing and masking early on, vaccination thereafter. Now we can blunt it even further with boosters and vaccinating all age groups that we have, especially those that are around others. So, with age 5 and older, all school-age children being eligible, this will be able to help mitigate the amount of spread that we have. But we are still rolling out vaccines in that 5 to 11 age group. Boosters are now available for everybody 18 and older, but we don't have all of that done. And so with that, we can expect with colder weather, when we know that all viruses circulate more, as we've been saying for months, that we expected that things would go up a little bit in the wintertime, no matter what we do. But there are ways that we can still protect ourselves and protect our community even further going into these holidays by getting boosted.
WTIC 1080 News.
Doctor, how are you feeling about holiday travel and masks at Thanksgiving dinner, things like that?
So I think one of the challenging things as we start to think about this is the fact that everybody at some level has to assess the risk of those people who are around them and those that you are going to be seeing. So if you have a fully vaccinated group of people and fully boosted group of people, I think you're at your highest level of protection in terms of the number of people that you're going to see. If you have somebody who's a little bit more vulnerable in your group, I think for that person in particular, wearing a mask is not a bad idea. That's a self-preservation measure that that person can do. If you have unvaccinated people who are coming to your gathering, certainly they would be at highest risk, both of being infected and potentially getting infected, even if somebody around them who was vaccinated may have had a mild case of the infection. So I think it's an uncomfortable decision, I think, for some people to have to weigh for themselves in terms of what is their own risk, what is their comfort level in terms of those around them. But one thing I can say is those who are vaccinated and particularly boosted are the most safe in the group. And ultimately, you have to look at the risk level of those who are coming to your dinner, both at the older level, and then if there are young children who maybe are going to preschool and don't even have the opportunity to be vaccinated yet, that's where you can think about those additional measures of either masking when you're together, testing the group in advance. I think those are the other measures that we have in place to try to mitigate the risk of spread in your family.
For the unvaccinated, how transmissible is this virus? I think people might have forgotten that it does travel very easily.
It is absolutely clear that this virus finds those who are unvaccinated. As the governor mentioned, 5 times more likely to get infected, 10 times more likely to get hospitalized, and 15 times more likely to pass. One thing we're seeing in these last couple of weeks, particularly after Halloween, is that we have seen an uptick in cases in the 5 to 11 age group. This is a group that is out and about. It is also the group that's been unvaccinated until now. And so if that shows us anything, it just reiterates to us that this virus will find the unvaccinated. And so if you've still been on the fence, I would just suggest that you consider getting vaccinated.
The Associated Press.
Thank you, Max. Good afternoon, everyone. Governor, regarding the booster clinics at nursing homes, is this going to be for the residents or for the staff, and or both? And I guess, why was this not done earlier? Was it left up to the nursing home owners?
Hi, Sue. It'll be for both staff and for residents. Many of the staff were only vaccinated, say, 6 months ago, many longer ago than that. Obviously, we made it easy for them to get vaccinated previous to this. Now we're bringing the clinics right there to make it easier still.
Will this be similar to what was done before, where you have, like, say, CVS come in and work with certain facilities?
Josh, do we have any contracts on that? Is that CVS?
Yes, so and to be clear, these clinics started as soon as boosters were approved. So this is not, Sue, I think your question implied a little bit that, why didn't we start sooner? We started as soon as boosters were approved. Many homes got these clinics done within the first week that boosters were approved. What we're talking about now is some of the stragglers. As we've seen in the past, unfortunately, some homes take a little longer to get organized, and so Dr. Juthani and her team are pushing those homes hard to get those clinics done and making sure that everyone in those homes who is eligible gets a booster.
Great, thank you. And another question I had was, I understand about a quarter of the state's correctional workers are still not vaccinated and they're getting tested weekly. I realize that federal COVID money is paying for this, but how long is the state going to continue covering the cost of testing for state employees who don't want to get vaccinated?
Well, we've announced and agreed that we will continue to cover the testing for those who opt to do that rather than get vaccinated amongst state employees as long as the public health emergency remains in place, which at this point is middle of February.
And then what happens?
We'll evaluate as we get closer to that date.
Okay, thank you very much. Happy Thanksgiving.
You too. You too.
Hearst, Connecticut Media.
Thanks, Max. Hi, Governor. Can I ask Dr. Giussani 3 quick questions, please? From my colleague, Julia Bergman. Dr. Giussani, why are COVID-19 cases increasing at a faster rate than other states, despite one of the highest vax rates in the country?
So we know that in the winter season, there is the transmission of virus all the time, more so. First of all, when the humidity goes down, viruses are able to circulate and stay in the air for longer. And we know, as it's getting colder, that people are going indoors, people are socializing more, and so this is just a recipe for how the virus transmits. We saw, like the governor mentioned, that when it was hotter and people were indoors in some of the southern states with AC blowing, a lot of their rates were higher. And now, as the weather gets better there, we saw this last year too, the rates were lower there. And in the winter season, this is when our respiratory viruses always circulate more. And we can see certainly certain events that may happen, and as the weather's getting a little bit colder and colder, that this is going to sort of spread a little bit more in the community. But again, we have the tools at our disposal to try to blunt this, and blunt it even further than where we would be if we didn't have the opportunity to boost and do some of those other things that we know to try to curb the rise in cases that we're seeing.
And is the increased rate a sign that immunity may be waning in the adults who got there? Yes.
Yes. So I would say that particularly in our oldest age groups, we know that they were some of the first vaccinated. So going back to January and February, we are now many months, 10 months into their initial vaccination series. And one thing that we saw and can learn from the experience in Israel is that they also were able to vaccinate their population very early on, back in December, January. And as they saw waning immunity and a rise in cases, and then they rolled out boosters more broadly, they were able to blunt that rise in cases, and things have normalized quite a bit from the rate of rise of cases that they had, where they are accepting international travelers as of November 1st. So I think that that experience says to me that there's something that we can do also in terms of blunting that rise in cases for us as well.
That sounds like it's an argument for the younger, healthier adults to go get boosted.
So I think that what we know is that for 50 and older, that waning immunity is more likely to end up with potentially hospitalization or more serious consequences. For the younger population, I think if you are out and about with others, which many are going to be over this holiday season, that is by definition a risk of being able to transmit the virus. And so, you know, the current recommendation is that you may be able to get a vaccine, and that's a self assessment on whether you think you're somebody who would benefit from getting a vaccine. But what I would say to most people is that if you're going to be out and about and socializing with others, then this is a good way to protect yourself and protect others that you would be meeting as well.
Thanks. And finally, is there evidence that more people are getting flu shots in this atmosphere?
Yes, so we've had good uptake of flu shots, and I would say that we can continue work in that way. We have not seen much flu circulating, and particularly in terms of hospitalizations. There is flu in our community in Connecticut, but we are definitely seeing uptake of flu shots. But I'm glad you brought this point up, because we want to continue to have people getting their flu shots as well.
Thank you.
Thank you.
The Hartford Current.
Hi there. Governor, you kind of touched on this before, but I just wanted to confirm. So have you given any thought to a statewide mask mandate or any other sort of statewide restrictions? And can you envision a scenario where this current spike gets to the point where that would become necessary?
Alex, I really can't. I've seen that each wave has been less than it was before. I think we're going to see real pickup in terms of boosters. You're going to see real pickup in terms of the child vaccines, and I don't foresee any additional mandates. Certainly not given the current state.
And so, Dr. Giuttani, so if you were advising town and city officials who have to make this decision about mask mandates, if a mayor, first selectman called you up and said, you know, I see the numbers are rising, what should I do? Should I mandate masks in my town or city? What advice would you give them?
First of all, I would say that they should be talking to their local health department as well, because these are the people who are on the ground, talking to them on a regular basis about the status of the virus in their community on a regular basis. So that's the first thing I would say. I think at this point, as I said earlier, people are well aware of what the benefits of masking is in our community. I've been into many places in communities that do not have mask mandates, and 95% of the people in a grocery store are wearing a mask. So I think at this point, you know, we need to let local health officials who have been dealing with mayors and local representatives on what's going to work in their community to be able to advise them, because they've been doing this all along. And especially in these last several months where decisions were made to enact mask mandates and then take them away. And now we're going into a winter season again where we have more transmission of this virus. But people in the state of Connecticut know what masks have done to help protect them in their community. And people are making that decision every day when they go out into their community and see that by wearing a mask, a lot of times they're able to go about their lives safely. And it's an asset. It's a tool they can use to be able to go about their lives and live it freely.
So what would you say to somebody who goes to the supermarket or something and sees a lot of people around them who are not wearing masks and feels unsafe because their neighbors who they don't even know if they're vaccinated, but even if they are, their neighbors are choosing not to take that precaution?
I understand that's a challenging situation, and at the end of the day, we can do the best we can to protect ourselves. You can certainly wear your own mask. I think if you keep distance from others, then that's a way to protect yourself as well. You can choose which line to wait in to pay for your groceries. You can stay a little bit further. You don't have to go into that crowded aisle that has everybody buying the things for Thanksgiving that they need right at that moment. Maybe you wait a little longer. So there are ways that you can still protect yourself even if you see a lot of people around you who maybe are unmasked.
So then last thing, same thing I asked the governor, could you imagine a scenario where the numbers go up to the point where your answer to this would change and you would advocate for statewide restrictions?
I don't anticipate, I would defer to the governor in terms of what his advice and recommendations would be. But I think at this point, really, the hospital census is the thing that would really drive any sort of changes. And I don't see us getting to a place where we've been before with therapies that we have, including monoclonal antibody, vaccinations, boosters, all the different things that science has been able to help us with to be able to get where we are, to get to a point where the hospitals are at a breaking point like they were very early on in this pandemic. That to me would be the number one driving factor for making advice on decisions like that.
Thank you.
The Waterbury Republican American.
Thanks very much. Dr. Giussani, we're getting some questions about boosters from readers. Are you considered fully vaccinated if you have not had a booster shot? You've completed your vaccine series, but you haven't had a booster.
Current guidance from the CDC is that 2 shots is fully vaccinated. Now, this may change. As we know, and we've seen through this pandemic, we get new information. We keep learning new things about this virus. We also are learning new things about the vaccines as we go along, because we are learning when immunity wanes as we follow people who have been vaccinated. So that may change with time, but at the moment, 2 shots is still considered fully vaccinated.
And do we have, is there any evidence yet about the waning immunity post-booster shot? Just sort of wondering, okay, you get your booster, and then how long after that, might your immunity begin to wane to the point where maybe another one would be advisable?
I don't think we have the information on that yet, Paul. I think that all of these trials are a few months ahead of what we're living every day. As the data come out, policy changes go into effect to reflect the new data that we get from these clinical trials, where people who signed up for them, got on board early, maybe got those boosters, and now we're following them. And so I just don't think we have the data yet. We haven't had enough follow-up. Not enough time has passed for us to know how long that booster immunity will last. My hope is that boosters will get us through this winter season, and that if we're lucky, we will be able to get some time where we see how long those boosters last before we deal with another flare-up. Over time, over a longer period of time, I do expect this virus to be a little bit more seasonal. The Delta variant really caught us off guard, quite frankly, where we had that surge in the summertime, which was a little bit more unusual. But that just shows us how infectious this virus can be. We're going to have to stay on our toes, keep learning as we go, and maybe if we're lucky and we have enough immunity from the vaccine and boosters, we'll get a longer stretch before we get another small flare-up. And by then, we'll have more of a sense of when we may need another shot potentially for this virus.
Okay, thank you. Josh, can you give us any updated numbers on the number of state employees who have been terminated or in the process of being or on suspension for either failing to comply with the vaccine or testing mandate? Do we have any information on religious exemptions and medical exemptions? Any information on state contractors? It's been a while.
Hi, Paul. Yeah, in fact, I think we're planning on releasing the latest updated data, maybe even tonight or tomorrow. But just to give you some highlights to your question specifically, so far there's been now a total of 31 employees have been separated, 35 have been placed on unpaid leave, 42 are in the process of being placed on unpaid leave due to refusal to comply, and we continue to have another several hundred that are in a state of non-compliance but are working to get compliant because a test result is late, and we work with those employees to help them get compliant. So the good news, and you'll see this in the data, is we've increased another 3 percentage points in terms of the percentage of the state workforce that is fully vaccinated. So last time we released data, we were just over 80%, and now we're up to almost 84% of state employees fully vaccinated. So that's the good news.
Okay, thanks very much. And just one final question for the governor, Dr. Chastani. Is there a sort of I don't know if it's the herd immunity kind of equivalent for boosters? I mean, obviously we've got about, I think 2.5 million who are fully vaccinated. I would imagine you'd want to see all 2.5 million get a booster shot. But is there sort of, I don't know, something less than that would be okay, public health wise?
So, Paul, one thing I can offer is we don't really know the answer to that question exactly, but if we look at the experience of what happened in Israel, when about a third of their population got boosted, they started seeing the curve of cases come down. Now, that happened at a different time of year, different season. So how is the winter season going to add to that for us here in Connecticut and in the Northeast? We don't really know the answer to that. But I do think that at least that is one piece of information that can add to the narrative that boosters can help curb this and bring down the curve. And maybe it's possible that we need more than a third of the population, but that's at least something to start with.
Okay, thank you.
The Connecticut Mirror.
Hi, my question is for the Health Commissioner. On the children's COVID vaccines for the 5 to 11 age group, how is the state ensuring those vaccines are reaching children who might not have good access to the healthcare system? I know you mentioned the school-based health clinics. Could you expand on the state's efforts?
So we've had a very robust vaccine equity team that has been working with our communities to be able to bring our DPH vans into communities and meet kids where they are, meet families where they are. Sometimes we have both a 5 to 11 van and a 12-plus-year-old van in the same location, so families can come together and get their vaccines. And so we're doing exactly that. We've got 400-plus clinics that are set up, and they're growing every single day in all different communities throughout the state. So we're doing exactly what you mentioned, trying to get vaccines to all those who want to be able to have access to them and bring it to people in their communities.
And could someone elaborate on the clinics for nursing homes? How many of these have been held so far? And if you guys are expanding, is it just nursing homes or assisted living and other long-term care facilities included?
Yes, absolutely, Jenna. So a few things. First of all, when the first boosters were authorized, it was only Pfizer. And so there were Pfizer clinics that were starting in the long-term care setting. Then both Moderna and J&J were approved. So now all the nursing home residents in a given home would be eligible for some kind of booster, because different patients got different things in different homes. And so what I can tell you is that we are on target for 70% of long-term care facilities in the state of Connecticut having a booster clinic for patients and staff by Thanksgiving. So in this week, up to 70%. The remaining are the ones that we are helping to get done with a booster clinic by December 15th. So we are very much on target on this. This isn't something that just started in the last couple weeks. The homes have been doing this. Many of them are already done, as I mentioned, but we are well on track to make sure that this population is protected.
And is this something the state is funding?
So most of the time, these are pharmacy clinics that these nursing homes have had relationships with directly. So the homes are setting up clinics with their pharmacy partners. If they have a problem, then we are helping to connect them with appropriate pharmacy partners to be able to help them do that.
Thank you.
CT News Junkie.
Thanks, Max. Hi, everybody. Governor, as you mentioned, there's some community spread right now. It seems like it's reasonable to expect throughout the holidays infection rates might increase. Do you still anticipate that come February you will no longer need your emergency declarations?
Well, I sure hope so, Hugh. I really believe that given the boosters, given the 5 to 11, given some of the therapies and the same-day testing, we're going to have a variety of tools that weren't available to us a year plus ago that will not require the emergency orders any longer. I can't predict the future, but I'm very hopeful of that.
Okay. You guys released some numbers today on school vaccination rates of employees. Some of them were pretty high. There was a few real low ones, though, for smaller private schools. Are you concerned? I think one was as low as like 7%. Do you worry about these smaller schools where maybe folks aren't getting vaccinated?
Sure. I mean, yes, if there's, where there are schools that have lower rates, yeah, that is, of course, of concern to us. And that's one of the reasons we collected this data and published it, right, to provide transparency and hopefully a little extra encouragement for some that are a little lower. But I think the main story from that press release is the exceptionally high vaccination rates that we're so fortunate to have in our school staff here in Connecticut, and the really phenomenal job that our districts and our partners and the teachers unions and all of our educators across the state have done in getting their teams vaccinated at incredibly high rates, keeping our schools and our classrooms safe.
Okay. Josh, this probably is hard to quantify, but you guys were saying I think like 18% of folks eligible to get a booster had gotten it. Is there any similar number you can put on like nursing home residents, or is there a certain percentage of them who have had boosters at this point, or any way to quantify that at all?
Yeah, we have been tracking that. Do you have that tracking on the item?
What I can tell you to start with is that once a nursing home has a clinic, upwards of 95% of the residents have gotten boosted. And what I can say is that we have 70% of homes that have a clinic scheduled for Thanksgiving, and the rest will be by December 15th. So we are on track to be able to get all of the residents boosted by December 15th. I think that would be a fair statement, or very high numbers, upwards of 95%.
Okay, but we don't have a number for let's say right now, or how many have been done already?
Yeah, so we have some numbers on that, and what I can tell you is it varies based on which home it's in, but overall, I think that it's more like based on which particular home has already had their clinic, and so that's where I have a little bit of difficulty in coming up an exact number for you, because different homes are on a different schedule.
Okay, thank you.
The Day of New London.
Thanks, Max. Hi, everyone. It's Sten with The Day. Has the increased spread affected schools in the same way that it has the general public? And have you seen some schools moving to remote learning recently, at least temporarily?
I'll start with that. Very little of that. I am so happy that our schools were open, Sten, a year ago, September, and not all the kids came back. Most did, but not all the kids. This time our schools are all open. All the kids are coming back. We've had very few, quarantines, very little remote learning, more in-person learning. That wasn't true of some of the school systems down south a month or two ago when they were flaring up and not wearing masks, where kids were losing, thousands of hours. And then we changed the protocol where even if there was an exposure, but you're not showing any symptoms, you'll be able to get back in the classroom. I think over the last few weeks, it's even easier for kids to be there. And I'd like to think that with the same-day testing and therapies, those days of missing in-person learning are over.
Okay, great. And last thing, are you planning on continuing to hold pressers like this until the spike subsides?
Well, the answer is yes. With decreasing frequency, I hope. We were every day, then we are twice a week, then now it's been a couple of months. Look, I think it's an informative way to give people an idea of progress and how we're doing, but not to be alarmist. And look, I'll just say I'm getting the signal from Max that, look, you look around the country and you see the exasperation and the frustration, and in Wisconsin, you see overseas, you see the demonstrations in, Austria and, parts of the Benelux countries, and, there's a big, I'm mad as hell and I'm not going to take it anymore. And, look, we all understand how long this has gone. But I hope we've tried to leave you with an incredibly hopeful note that with the boosters, with 5 through 11, with a lot of the same-day testing therapies that are going to be soon in the offing, we are rounding the corner on this thing. This is going to be a really good time in terms of a return to a new normal, and I can't wait for that day. But as frustrated as you are, I just want to give a special shout-out, since Paul reminds me it is Public Health Appreciation Day. These nurses and docs, they've been showing up every day now for close to 2 years, right there on the front lines. They can't quit. They can't take days off. They can't say, I don't feel like it anymore. We need them desperately. So I know it was a while ago that we were all saying you're heroes. This is a good day to remember everything they've been doing for us. And I hope to God they're going to have a nice vacation soon enough. Thanks, everybody.